Okay, good morning everyone, and thank you all for coming. So we're the Griffith social marketing team. I'm Sabryna, Morgan, Kailas and Jay. And before we start, we just want to pay our respects to the traditional custodians on the land which we meet today. And today we're going to be presenting our solution to Challenge 2. So the world is made up of 7 billion people. So imagine having access to this much data. The possibilities would be endless. But why do we need data? Data is an asset. It helps us to make informed decisions, helps us find solutions to problems, facilitates research production, and improves people's lives. However, for many consumers, it's not just about the data. We need to provide consumers with timely, accessible, and easy to understand information to empower and engage them in the process. Without them, there is no data. So consent is integral to the research process and collection of data. We need people to agree to participate in data and be interested and informed about the research to produce more data. The more consent we have, the more data we have, and the more research we can actually produce. There are vast benefits of dynamic consent to consumers. It guides consumer-centered healthcare where consumers will understand who will benefit as they rely, depend on, and place their trust and vulnerabilities into the hands of researchers and clinicians. However, this process is not without its challenges. A lack of understanding with regards to how data is used, who uses it, and for what purpose results in hesitancy towards participating in data sharing activities. This is especially true for consumers of low health and low digital literacy, who may be overwhelmed and confused, but they still want to be heard. These consumers are often underrepresented in research, hard to reach via mainstream methods, and often have a high incidence of chronic disease. So providing these consumers with the necessary guidance and support to enable their informed participation in the dynamic consent process is key to their involvement. Therefore, the problem that our proposal seeks to address is how may we ensure that participants receive adequate disclosure and have enough information to make informed, supported choices so they feel comfortable, confident, and empowered to take control of their data. By improving the patient experience to empower and support consumers to engage in the dynamic consent process, we may improve health outcomes, reduce health inequalities, and ensure that all Queenslanders have a voice to be represented in research.
So to address this problem, we propose a fit-for-purpose, consumer-centred solution which considers cognitive and choice overload, a virtual ambassador. A virtual ambassador, also known as a virtual agent, is a human representation with human attributes that exists in a virtual world. Their behaviour is guided by programmed algorithms, but can potentially dynamically adapt through machine learning. Integration of a virtual ambassador in online portals may facilitate the ongoing communication of information that is easily accessible and digestible to consumers, as well as providing a mechanism for increasing their understanding and health literacy through clarification and gamification, thus empowering consumers to make the decisions that are right for them. Virtual ambassadors are cost-effective solutions that can be used to enhance the usability of online portals by guiding consumers through the portal in a friendly and personal way that it's easy for them to understand. Our virtual ambassador is the social mechanism to deliver our nudges, to make it easy for the consumers to navigate and understand the dynamic consent process. So having said that, it is our pleasure to introduce Morgan, our virtual ambassador. The functions of Morgan may include, but are not limited to, a companion throughout the consumer journey, guiding and supporting consumers through each stage of the dynamic consent process, a portal guide, acting as a navigator or the GPS of the dynamic consent process, a quiz master, by integrating gamification such as quizzes that engage and educate consumers in a fun and novel way to enhance and support their literacy, while also providing feedback to Queensland Health on consumers' literacy strengths and weak points. An educator, providing clarification and explanations where necessary, which may be especially useful for those who generally find it difficult to ask for help in traditional circumstances. A Q&A moderator, so similar to a chatbot, enabling two-way communication by responding to frequently asked questions and escalating to human advisors where necessary. a middleman, facilitating introductions and communication between consumers and researchers. A single source of truth to provide ongoing communications, for example, through electronic direct mail, while providing a consistent and continuous personality to enable familiarization and habitual behaviors, therefore increasing self-efficacy in the process. A social media influencer, supporting social norms and overcoming the spread of misinformation on these platforms. So as you can see, Morgan provides a versatile and flexible solution which can be adapted to suit the needs of a range of different portals and platforms and a range of different consumers' needs.
So why use a virtual ambassador, or Morgan? Our virtual ambassador is social and thus different and relevant to the opportunity, as it actually provides the ability to connect the consumer with the actual system. Through the ability to tailor and customize the features, such as the appearance, gestures, and the terminology used to actually convey the information, we can connect the consumer with and foster a trusting relationship. This is facilitated by processes such as homofication, creating an in-group relationship with the virtual assistant. These communications will be co-designed and continuously evaluated with the consumer themselves. Our virtual ambassador meets consumers at their point of need and facilitates our nudges through the consumer journey, with the virtual ambassador being a single source of truth for the consumers. As they walk through the information, it aims to engage the consumer in the dynamic consent process. As an example of this, it could be that the virtual assistant walks the consumer through each section of a study information sheet, using a simple quiz at the end of each section to confirm the understanding of the consumer, thus resulting in informed consent.
Our users meet Morgan on the online portal, potentially the patient portal. So it can be integrated across multiple portals and be involved in various touch points and various points in time. So this forms a holistic, flexible and scalable solution that guides the customer journey. So the ability to tailor our virtual human in terms of looks, feels, sounds, gestures makes it useful to a wide range of audiences and able to address a wide range of and unique needs. So how does our solution do this? So the design of Morgan was guided by the technology acceptance model, which says that the ease of use, the perceived ease of use and perceived utility of a technology is based on the affective, cognitive, and emotional factors, which ultimately lead to intention and uptake of the technology. So informed consent is built into this process and therefore embedded in the portal. So Morgan facilitates engagement by connecting researchers and users. So by using prompts, it connects consumers to information by nudging it to ask questions relevant to their profile, relevant to the user's profile. So in summary, to address the problem of ensuring participants receive adequate disclosure and enough information to make informed decisions, we propose a fit-for-purpose, customer-centric solution that is a virtual human. We believe the solution addresses cognitive and choice overload. And while we've just provided an overview of mechanisms and nudges that could be used, we really need to co-develop this solution so we understand user needs and make sure that we are meeting those needs. We also appreciate that what we've talked about today is just one step in a very big process to operationalize dynamic consent. But we believe we have a solution that empowers consumers by giving them information in an accessible and understandable and timely way so they can make these decisions about their dynamic consent. Thank you very much.